and welcome to Quality of Life Radio, hosted by Lisa and Nancy, editors of BigBlendMagazines.com.
Dr. Jacqueline Eubany, a board-certified cardiologist and electrophysiologist, is joining us back here on Big Blend Radio today. She's the author of the must-have book, Women and Heart Disease, The Real Story. And what we love about Dr. Jackie is she is on a mission to educate women and their families about heart disease, and she's back here today to talk about cholesterol. Yes, the big C word, cholesterol. There's good cholesterol, there's bad cholesterol. Bring William Shakespeare in. Does he know? I don't know. Did he know about, the good, the good, bad, I don't know, to be, not to be?
I don't even know if they had that word back then.
I don't think so, but she knows. We're very proud to have her as a regular expert here on Big Blend Radio, and also as a part of our Big Blend Radio and TV magazine. Sometimes she's on the show talking about her world travels, but today she's here, as I said, to talk about cholesterol. You can find her articles and interviews on blendradioandtv.com, and also go to her website, womenandheartdiseasebook.com. And ladies, this is a book you need to read. She's got great examples, tells stories about different women that have had maybe a heart attack or different issues with cholesterol. It's very important because, as we've learned through Dr. Jackie, heart disease is actually the #1 killer of women in America, killing more women than breast and lung cancer combined. So it's very important. So Dr. Jackie, welcome back. How are you?
I'm doing well. Thanks for having me. It's always a pleasure to be on the show.
You know what? We're excited because a little birdie told us that you are starting your own practice. I just want to let that out.
That is correct. I am starting my own private practice here in Orange, California.
In Orange. So not Orange County, in Orange.
Well, Orange is a little city in Orange County. Yes.
Okay. It's very historic. I know. We actually know a lady in Carlsbad, California, and her son runs the newspaper of Orange. And remember Opie, Nancy? She has a little history museum next to her shop, and she's been like the go-to shop for the neighborhood for years. And she created a museum across from her shop, and like a taqueria, and it's actually amazing. And that was how I first knew about the city of Orange. And you say it's like a town, but is it a city, or is it just? From what I
it's a little city.
Quaint. Yeah, it's quaint.
Yeah, it's a little city. Yeah, it's a little city in Orange County. The Orange where my practice is, anyway.
Well, we like that you have your own practice, and I think that's amazing. I mean, that's a huge thing to undergo, right? There's a lot to it to be able to open your doors and say, "Hey, welcome," and have all the equipment and everything. That's a big mark in your career.
Yes, it really is. It's a big endeavor, but it falls along my plan of educating more women about heart disease. So it's going to work out very well.
Cool. I want to ask you this. I know, you've been on our show for a while now, but I always like to go back to the fact of being a cardiologist and electrophysiologist. That's my favorite word, right?
Yes, I do.
What was it about heart disease that you said, okay, I'm going to get involved and combat this? What was it? And especially for women.
Well, for me, I mean, I've always found the subject, any subject related to the heart, to be very interesting. But when I really began my career as a cardiologist and taking care of patients with heart disease, especially women, and, seeing the higher mortality rate or the way women present differently with a heart attack or heart disease to the emergency room, how they get treated differently and how their outcomes are usually worse than their male counterparts, it just really had me thinking and doing more research and, learning about it. And the more I talk to women, I come to realize that women just don't they don't know that heart disease is the number one killer of women. And so that's where it all came about, that I just need to educate more women about heart disease.
I think a lot of us always think about a woman's disease is breast cancer, cervical cancer. Those are the two things that come to mind immediately, and not heart disease.
Yeah, absolutely. I think that the Breast Cancer Society, the Susan G. Komen has done such an excellent job in bringing up awareness about breast disease in women. But I don't think that, the community of heart disease, or the community of, heart doctors in general, has done, such a great job of bringing that awareness to women. And I think that's what's lagging in our community.
Yeah. And
I think you always kind of think that's a male thing, because
right.
I think you think, at least in my brain, you think about men doing physical labor and working, and then heart attack kind of thing, and you relate.
Yeah, the big physical labor, then come home, have meat and potatoes, and then have a heart attack.
Yeah, and you don't see I want to call it the silent suffering on the other side, where the woman is doing so many things throughout the day, tending to the children, taking care of maybe an online business, taking care of making sure the meals are on, and the stress related. And I feel like eventually that's what maybe tends to lead you towards that heart attack.
Yeah, it definitely can. It can be an additional stressor that leads to a heart attack. But you're right. A heart attack has always been looked at, or heart disease has always been looked at as a male, disease. Yeah. Even in the past, a lot of our studies looking at heart disease have mostly focused on men. There's mostly men involved in these trials, men involved with, picking medications that are appropriate for heart disease, that we've sort of forgotten. We've sort of forgotten women. But more recently, there's been more awareness about heart disease and women, and more emphasis is now being put on research to look at heart disease in women, and treatment. All these treatments that we've been using were mostly studied in men. We're trying to have more studies where women are involved to see if they have the same outcomes with the same treatments that men are, receiving for heart disease.
See, we have to fight for our stuff, man. I'm just saying.
Yes.
Like, hello, look at us. We're here too.
Yeah,
no,
exactly.
But I want to say, like, cholesterol, which is our topic today. Cholesterol is just such a, like, you hear cholesterol, and all I think about is oil in a pan. When that's literally, I'm being honest, like, that's just what I see. Anybody says that, that's what I see. And I know olive oil is good for us, and things like that. But then I don't understand, because there's like good cholesterol, bad cholesterol, but I don't really actually understand what cholesterol really is in our bodies. What is it?
Where is it lurking?
Yeah.
So cholesterol is, what we call a steroid alcohol. It's kind of like a waxy, fat-like substance, but it's not actually fat. It's present in all of the bodies and all the cells. And, a lot of the hormones that we have in our body, or some of the hormones we have, require cholesterol as precursors for making the hormones. One that comes to mind directly is vitamin D. You just need cholesterol. So the body needs cholesterol. So in our body, our livers actually produce some of this cholesterol that we need to produce some of the hormones that we need for our bodies. So that's one source of cholesterol. And then, of course, the other source of cholesterol is ingestion, the cholesterol that you ingest by eating. So those are the two big sources of cholesterol in the body. But cholesterol overall is a good thing. Your body needs it. The question is just, too much cholesterol, as in anything else, too much of anything else is never a good idea.
Okay, so there's good cholesterol, bad cholesterol, right? And I know, like, Nancy and I, we're allergic to fish, and I have nut allergies. Go figure. Happens in later in life, I grew up on cashews in Kenya, and I thought that was cool. And then later, my body said, like, I don't know what happened, but something happened. But I can eat peanut butter still. and that's a legume. I know it's not a nut, so that's good. I do know that. But there's this good and bad, and we've learned that you need to have your omega-3s, and we take flax oil, like little flax oily capsule-y things, and do that because we can't take fish oil or we can't eat fish, and we don't eat half of the things. So we've learned, like, okay, we need to do that, and it's better. Suddenly your hair is like, oh, a little bit happier. Your nails are a little bit happier. Is that connected to our heart health when we do the omega-3s, and is that connected to cholesterol?
So the omega-3s, that's fatty acids, which is a little different than cholesterol. Cholesterol is more of a steroid alcohol, and fatty acids are fat. So let's talk about cholesterol first, and then we can talk a little bit about fatty acids. So you're right. So cholesterol, there are two kinds of cholesterol. We separate them into, for just a better understanding. It's actually much more complex than this, but we separate them into what we call bad cholesterol versus what we call good cholesterol. Now, the bad cholesterol, we call it bad because as it's circulating through your blood system, it deposits within the walls of the arteries. And by depositing into the walls of the arteries, it makes your arteries, the lumen of the artery, get smaller and smaller. So it's restricting blood flow and oxygen to organ systems. Whereas the good cholesterol, or the HDL cholesterol, it is actually, for lack of a better word, the cleaner of cholesterol. It goes through the bloodstream and it removes cholesterol from the walls of the blood vessels. So it's just cleaning out your blood vessels. So that's why it's considered good cholesterol.
Goodness. Yeah. And then the bad one is the low def. Like, you think about high definition photos. And,
right. So we call the low density lipoprotein versus the high density lipoprotein. Exactly. So when you go and get your cholesterol checked, they give you a breakdown of what your low density or LDL cholesterol is and what the amount of HDL cholesterol is. So you want high numbers of HDL and you want low numbers of LDL cholesterol.
So what is the triglyceride thing that comes into play there?
Yeah, so triglycerides are the fatty acids. So that's a different component, but it's not cholesterol. It's just a different chemical component than cholesterol. Cholesterol is more of an alcohol, whereas the fats are just, liquid and fatty acids.
Cholesterol is wine. We're back to the wine. We're always going to go back to the wine. And only 5 ounces, ladies, a night.
Yes, only 5 ounces.
Okay, so wait a minute. Our body's producing alcohol? Is that what's happening?
Well, it's producing cholesterol. It's a precursor. It hasn't quite been, oxidized into alcohol yet or fermented into alcohol. But no, it's a precursor, cholesterol.
We haven't had the fermentation yet. We haven't aged it out yet.
We have
but
wine
exactly
in our body.
I know. I'm like, well, that's what's going on in my belly. That's why it's poking out there.
It's my wine barrel.
I know, it's my wine barrel. But no, okay. So when we look at LDL and HDL, so HDL is good, and the LDL is like, we've got too much of that. A lot of us will, you go to the doctor or you go to, you whatever you do, you're gonna get that report back, and it's gonna go, yay, nay, this is high, this is low, and when it goes into the LDL, then we have to worry because that's not the good cholesterol. And so what are some of those things that are not good? Would it be like smoking? I know you need a sip of water there, Dr. Jackie. I know, and I know she's not smoking.
I know.
Dr. Jackie would never allow smoking. I know that. That's
never, ever.
No.
Yeah, so there are certain things that, of course, you can do to increase your chance of depositing these cholesterol plaques in your arteries, like you talked about smoking. Smoking definitely damages the blood vessel. So when you damage your blood vessel, it just increases the likelihood that the LDL or your bad cholesterol will deposit these particles into your arteries and block it off. So other things that can lead to that, to narrowing of your arteries include, again, obesity. People who are obese tend to have a higher risk of having the LDL deposit cholesterol into their arteries. Of course, eating too much fatty or high cholesterol meals will increase the risk or increase the chances that the LDL will deposit.
So, Dr. Jackie, there's good and bad cholesterol. I know smoking has got to be one of those that are not good. You know, as a teenager, I didn't think about cholesterol being connected to smoking. How does that happen? Because I thought that was fat. Cholesterol, I always said, it's the fat in the pan.
So you're absolutely right. There's what we call the bad cholesterol, and then there's the good cholesterol. The bad cholesterol, we call it LDL, or the low density lipoprotein cholesterol, and the good cholesterol we call HDL, or the high density lipoprotein cholesterol. The LDL is considered bad cholesterol because this is the cholesterol that actually deposits within the lumen of your blood vessels. And when that happens, it causes the lumen to narrow or get smaller, and you decrease the amount of blood flow to organ systems. So decreasing the amount of blood flow decreases the amount of oxygen and nutrients that the organ is receiving, and that overall is considered bad. The HDL cholesterol is the good cholesterol because it actually takes the cholesterol out of the lumen or the walls of the blood vessels, and it causes it to open up a little bit better. So that's really the difference between both. And whenever you get your cholesterol drawn in the lab, they usually have it broken down into LDL and HDL, and you want lower numbers for your LDL and higher numbers for your HDL.
Okay, so if you get good numbers for HDL, and then they say like LDL, like you're in trouble there, does that, then what are we doing wrong? Like, could that be smoking? Okay, or
right.
I mean, wiggy time, cocktail time. Are we going to have to go to the 5 ounces? Are we in trouble again?
Yeah. So if your bad cholesterol is high, it means that you're increasing your risk for heart disease or heart attack, because the lumen of your blood vessels get narrower and narrower, smaller and smaller, and therefore you're not getting blood and oxygen to your organ system, so you're high risk for having a heart attack. But there are ways to prevent this from happening, like you alluded to. Cigarette smoking. If you smoke, you should quit smoking, because we know that smoking cigarettes actually damages the walls of the blood vessels and increases the propensity for cholesterol plaques to be deposited within the blood vessel. So if you're smoking, you want to quit smoking, because that is definitely helpful. You want to decrease your dietary intake of cholesterol or trans fat. You want to make sure you increase your physical activity. And if you have other risk factors like diabetes, you want to make sure that's all well controlled. And of course, alcohol, we always get to the alcohol conundrum, because there are some studies that have shown that alcohol can be beneficial. We talk about the 5 ounces. Studies show that specifically red wine can actually, 5 ounces or less can actually increase your HDL levels. So it increases your good cholesterol, and therefore that's beneficial. But once you start crossing over into excessive alcohol ingestion, then it lowers your HDL and it increases your LDL cholesterol.
And there's also the waste thing, and I know I've laughed with you before on the show, but it's true. I mean, if it's interesting because I always say Dr. Jackie's sitting on my shoulder as tours and stuff. She's like, over holidays, like, no Christmas cookies for you. You have your 5 ounces of wine. I'd prefer that. But as we go through, like, you see people and even myself, I go like, okay, there's that upper belly thing that happens to women. And I often wonder how much of that is food or is it alcohol? Because I've also read that women, especially like if their partner has passed on, that women start to increase their we have an alcohol problem in women, especially single and older women. It increases. And so I'm wondering about that and heart disease. And then now knowing that it contributes to cholesterol. I never thought alcohol or cigarette smoking would be part of cholesterol. I didn't until reading your book. I really didn't know that.
Yeah, they're all intertwined, and they all cause, they increase your risk for heart disease. But yeah, abdominal circumference is a big risk factor for heart disease. There's something about accumulating fat in your abdomen, which seems to be a whole lot worse than accumulating fat, say, in your lower extremities or something like that. But increased abdominal fat definitely increases your risk for heart disease. So having that along with high cholesterol can be bad for you. But as you know, as we get older and as our metabolism slows down and as we eat or drink, our waist just gets bigger and
what
bigger.
What are you talking about, Dr. Jackie? I have no clue about that. It just gets easier every day. Really? I get up earlier every morning.
That's why they invented the moo-moo.
And before the moo-moo. Yeah, Mrs. Roper. Hey, listen, I'm all for that.
The moo-moo.
The moo-moo. The moo-moo.
That's right.
When you start looking at moo-moos, you better check out what you're eating and drinking.
Call Dr. Jackie.
That's right. I mean, it happens to all of us as we get older, but we just have to be very careful about it. We have to increase our physical activity and watch what we're ingesting into our bodies, and quitting high-risk behaviors like smoking and things like that.
I think this is just so fascinating because I always thought cholesterol had to do with if you eat cheese or not, and of course it does because when part of me going vegetarian, I was vegan, but I learned also being vegan not to eat processed foods because they actually harmed me more. I thought, I was doing really great when I was eating whole foods and being vegan. My body, man, I was like a killer chick, man.
No,
I could my muscles were there and everything. But then I started incorporating dairy back, and then I said, I'll just eat veggie burgers from the frozen foods department, and then my immune system shut down pretty much, almost my hair wasn't doing good, my teeth everything went lopsided, and I know that some's got to do with allergies and also just processed stuff that isn't good for you, and I went away from the whole foods, and that's the interesting thing to me is we can have this balanced diet, and some people want to eat meat, but maybe not eat it 3 times a day. We don't have to. We've done an interview with the guy who started the Reducitarian Foundation, and we've got a cookbook. He's got a cookbook coming out, Brian Capeman, and it's about we want to be vegetarian and vegan, but we still want to have a burger once in a while. We're not going to be full-fledged this way, but we understand the environment and our health. And so they really try to work on people just having reducing down, not eating meat every single night. Because I don't think we ever did that in our history of humankind.
Not in the hunting gathering.
Right.
When we were hunter gathering, you were lucky if you got meat for the pot, and so that's how farming.
But I always thought that being vegetarian, we would cut down on the animal fat, which would help us in cholesterol. Does that help?
Well, so there are 3 components to cholesterol, and our body's level of cholesterol. Cholesterol, 1, comes from ingestion, whatever you put in your mouth. It also comes from the liver. So, your liver is able to increase production of cholesterol or decrease production of cholesterol depending on your body's needs for cholesterol. So there are 2 ways that you're getting cholesterol in your body. But this is also counterbalanced by your body's ability to excrete cholesterol. So there's a fine balance between all 3 ways, but you can have a problem with one or all 3 mechanisms that can cause your cholesterol to go up high. So we have patients who have hereditary abnormalities it's usually either the liver just producing too much cholesterol and not being able to regulate itself, or the body is unable to excrete cholesterol, which can predispose to higher levels of cholesterol. So patients like this with hereditary abnormalities can cut back as much cholesterol as possible, but still their cholesterol is high because their liver is not able to regulate the amount of cholesterol it's making. It just keeps overproducing cholesterol, or your body's just not excreting enough cholesterol.
Oh, wow. Wow. So it's complex.
It's complex. So, everything in the body is very, very complex.
And isn't it? It's like it's individual, right?
I think women's bodies
yes.
are really packed in with way more stuff than men's bodies.
Yeah.
Yeah.
I mean,
and those ribs just hold it all in there.
No, I mean, seriously, there's a whole lot more packed in there. It's like a cooler with way too many drinks in it.
Nancy
very
Hope.
Complex.
Nancy Hope. Well, that's the thing. So, where do we start? Do we need to start evaluating our diet? Is it diet? Exercise plays a part in this, right?
Oh, yeah, absolutely. I think, of course, that's the first place you start. We start with lifestyle modifications to help with, decreasing the total cholesterol of our body. So the increasing your physical activity, trying to maintain a healthy weight, quitting smoking if you do smoke, and controlling other risk factors like diabetes and hypertension. But again, if that doesn't work, then we can implement some medications to help lower your cholesterol.
Oh, wow. I didn't know that there was medications for this. But I want to say this, Dr. Jackie, it comes down to, like every conversation we've had with you, it comes down to a better diet, more exercise, less alcohol, no smoking. Am I?
Absolutely. It's the same thing. It's the same thing, right? For heart health, and not just the heart, but every single organ system in the body. It's the same thing. So I'm glad that we continue to emphasize it over and over and over every time we have this discussion.
Well, I'm always excited because I didn't understand like the cholesterol. I didn't get it. I'm blonde. I'm sorry, but I don't. I'm like I don't get this. There's cholesterol, and you want this, and you don't want this. And Nancy, I know Nancy's jumping up and down here.
I was just gonna add in there the cooking with fat. Does that hurt? Like when you're talking about, okay, you can get like trans fat-free margarine butter stuff. You can have real butter. You can have shortening. I don't know where that
Yeah.
When you're going to go cook, which one should you be using?
So just like cholesterol, there are fats that are worse for you, and then there are fats that are better for you. So we say that the polysaturated fats tend to be bad for you, and the polyunsaturated or monounsaturated fats tend to be better for you. I know that's a mouthful.
I'm going to have a Pollyanna reaction just now.
But the saturated fats tend to be the ones that are hard in room temperature, like the butters and stuff like that. And then the polyunsaturated ones are like the olive oils. And that's because they just don't have some double bonds in their chemical composition, for whatever that's worth. But those are better for you, like the omega-3 fatty acids. Those are polyunsaturated fatty acids. So you have those that are good for you and those that are bad for you. So you really have to distinguish which one you're cooking with or using. So I generally say those fats that are hard in, room temperature tend to be the more saturated fats, and then the ones that are bad for you. And those that are liquid, usually on the room temperature, tend to be the ones that are better for you. And in terms of the better fats, we talk more about canola oil or olive oil, because those are the polyunsaturated fats, or even the omega-3 fatty acids. They're polyunsaturated and they're good for you.
Okay. Wow. Okay.
We're doing it right.
We're all working towards this. I think everybody wants to be healthy, right? We all want that.
Yes.
And it's so difficult, and it gets so confusing out there. You go to a grocery store. I mean, I remember when we first came to this country, and this market of all these different things. Dr. Jackie, I know you were younger probably than me coming into this country, and going into a grocery store, and I was like, Nancy, why are there like 20 butters? I'm used to butter, and then here's margarine, and that's your choice.
It's really interesting. When we came back to this country after living in Africa, going to a supermarket, we put so much into our shopping cart that we eventually just left them.
We left it
because we're like, we didn't know what to pick.
I said
no, we didn't. We picked everything, and then we realized we can't buy all this. We don't even
know what it is.
We don't even know what we're buying.
But
we're only 2 people. We don't need all of this. And we didn't know what to do, so we just went to the guy and said, "We're sorry."
Bye.
Apologize, and we leave.
And we did. We went and said sorry. And that's the thing. It was interesting because I said to Nancy, I was like, "Why do they have so much? What's wrong with butter? What's wrong with this? Why are there so many choices?" And I wonder about I think all of us are overwhelmed and are confused about what to buy and what not to buy, and in our diet. And it's so easy to just order a pizza and say, okay, I'll get to it tomorrow,
Yeah.
And that stuff, like if you're going to have a pizza, make it at home, man. You can make a good pizza, not that stuff, not that stuff, not that stuff. No.
Right, exactly.
So, no.
But you're absolutely right. It's definitely better to cook your own meals at home from scratch. I know this takes a whole lot of time doing that. Most of us don't have the time to do it, but overall it's just better to do that because you control what you put into your own meal. When you have other people preparing your meals, you have absolutely no idea what is in it. And a lot of times the ingredients are preservatives and those are overall bad for you.
And how do you feel about the restaurant scene? I know you travel, you've been to over 60 countries now?
Yes.
How do you feel that the restaurant scene is it getting better? I mean, I've seen from the chefs that we interview, it seems like they're trying to get better and be more whole foods and more farm to table. Are we getting better in that?
I don't think so. I mean, I don't see any evidence showing that because they like to cook stuff that's really good, and unfortunately, a lot of the stuff that's really good doesn't have necessarily the best ingredients for your bodies in it. I mean, it's okay to do that on occasion, but it's when you do that all the time, that's when that's a problem for you. I mean, we all like to go out to eat because we like to try different things and, interesting, very, delicious food. But you just have to be careful that, a lot of times they're not going to be watching your cholesterol. They put whatever they want into it to make the food taste the best.
So
and it's not necessarily.
Mac and cheese in a restaurant, you gotta eat salad for the next week.
Right, exactly. So you balance it out. You balance it out that way because I can't tell you never to go out to eat because that is just unrealistic and nobody will ever do that. But at least just, do it in moderation and make sure you balance out all your other meals with healthier stuff.
Lastly, going into the cholesterol part again, does it change for our bodies as we, get into the finer red wine years of our lives as we age?
Yeah, I mean, it seems to, as we age, it seems like everything just seems to get worse. But yeah, your cholesterol also seems to increase as you get older. More specifically, when you hit menopause, as women hit menopause, their cholesterol tends to be higher overall compared to men, which is why postmenopausal women are at the highest risk for heart disease.
Okay, so when women go into that zone of their life, their bodies changing, the big change, does it affect your heart? Like, does it affect your heart health? Like, if you get, there's hormonal changes and there's weird things that happen to your body. And you go, like, what was that? And then you go, like, really? Now, is that going to affect my heart health? Do I have to do things to that? Like, does cholesterol come in play with that to balance my hormones? Can I take another flaxseed pill and say, okay, I'm good? Uh-oh. Did I ask that?
Yeah, unfortunately, as we get older as women, our risk for heart disease increases. We know that postmenopausal women have even higher risk for heart disease compared to men. And, we used to initially think that it was because of the lack of estrogen, but, there isn't enough solid data to suggest that that's the cause. But overall, as women get older, their arteries get stiffer, they have more high blood pressure, they're at higher risk for stroke, and everything just gets compounded. So that increases your risk for heart disease. But you can, of course, combat this again by doing the things that we talk about every single time that we have this discussion on the radio: increasing your physical activity, watching what you eat, moderate alcohol, quitting smoking, those kinds of things. So those things go a long way in reducing your risk for heart disease than anything else that we can talk about. But I think understanding that this is what happens as you get older, and trying to figure out ways to combat this is always a good idea.
I think that's the hard thing. I mean, I think it's just difficult. I think it's just difficult even facing all of that, But if you have the knowledge, you can work through it and create a plan. Be like us. Take a 1 hour walk every morning. It's really good. And when you don't, it's like it's a sucky morning. Walking in the morning, it's the best thing ever. Just saying to everybody.
I would agree with you 100%. I would agree with exercising is always.
But I'm just saying, it's like when you see the sunrise, you've got this positive outlook on the life, and you've walked. Like this morning, we walked, and all these songbirds were like just chirping away. It was like all of a sudden this one corridor of like this. You can tell who plants the right plants. You walk through, and all of a sudden, all these little birds are just the goldfinches were going off, and we're like, how can you be upset about waking up to that? It elevates your mood. And I wonder that last question. I know you've got to go because you always have a patient. You got to see. But stress levels, does that affect our cholesterol levels? That affect our body for heart disease?
It absolutely affects your risk for heart disease because we know when you're under a lot of stress, or when you're in the prehistoric time, we'll go back to then, our fight or flight response, when something very stressful happens to us, our adrenaline hormones increase, which causes our blood pressure to increase and our heart rate to increase. And, for the short term, it's good because it allows you to get away from whatever situation that is life-threatening. But in this day and age, we constantly are exposed to stress on a long-term basis. So having your heart rate and your blood pressure elevated over the long term will lead to, damage to organ systems and can increase your risk for heart disease.
Your organs get worn down.
Yes, they do.
Because we're being overused.
Do. I'm tired.
Absolutely.
And then if we get tired, we have more wine, and then that's not good. Or
exactly.
It's good. See, then we go into that stupid mode of like, I'm not calling people stupid. I can call myself that. But, we go into that zone of like, oh, I just want to feel better now because I've stressed myself out so much. And we need to on so many ways. I understand. But, take a walk. Exercise always helps. Sweat it out. Sweat it out.
No, I agree with you. And I think knowledge is half the battle. Knowing these things will help you get further and get along better than not knowing. Because if you don't know, exactly.
Thank you for what you do on that. Everybody, again, Dr. Jackie's book is Women and Heart Disease, A Real Story. You can get it on Amazon, but also go to her website, womenandheartdiseasebook.com. And Dr. Jacqueline, we call her Dr. Jackie because she's just so like, if you're going to go to a doctor, I want to go hang out with her. It's like, I know. Cool. I know. We have like white coat syndrome and like, she comes on the show and I'm like, okay, I feel good. I can do this. She's like I say, she's the angel on the shoulder, she's like there going, now, do you really want to do this? Like really, no, I don't. I'll behave today. And she'll make you laugh. But read her book because it really gets you into different scenarios that we don't really identify with. And I also want to say her book is not just for women. It is for families. Men, read it because so you understand what your wives, your partners, your moms, your sisters are going through, cousins. It's not just for women, so read that too. Everybody, again, Dr. Jackie, you can read her articles and listen to her past interviews on blendradioandtv.com and also in Big Blend Radio and TV magazine. And she's also going to be featured in our September-October issue of the magazine. So thank you so much, Dr. Jackie. We got music for you,
Yes, good. Thank you for having me. Let's hear the music.
Are you ready? Are you ready?
Yes, I am.
This one. Okay, so we like to play Gina Zavalis for you because we know you like really beautiful, uplifting music, and Gina, she's the best, and she's one of the best, and this is the song is "I Am Here," and that's what we're going to play today.
Okay, let's hear it.
Everybody, and Gina, I just want to say Gina's coming out with a new album, so get ready, everybody. We've been playing her for years, but here it is. I Am Here from Gina Zavalis, and you can go to her website, ginazavalis.com. Here it is. I Am Here. Thanks, Dr. Jackie.
Thanks.
Thank you. Have a wonderful day.
You too.
Some days it's hard to see, hard to breathe, so I look down. I'm lost and I need you. Where are you? Are you near me? 'Cause I found my heart, and I am carried away.